Well, chronic anxiety can rob us of inner peace and it threatens our health, but you can learn to manage it. Licensed professional counselor Dr. Bill Baker is here with us now. Thank you so much for joining us today.
Glad to be here, Nora.
Managing anxiety, it can be done with or without medication?
Well, medication is almost always a helpful resource for our anxiety. However, Nora, medication alone does not solve our anxiety problem. The best answer is healthy thinking. Unhealthy thinking feeds and maintains anxiety, whereas healthy thinking tends to either prevent it or help us to manage it more effectively.
So is this just taking the approach that the glass is half full as opposed to half empty?
Well, that's part of it for sure. Healthy thinking enables us to discern the connection between anxiety and fear. That is, we understand that fear is what feeds our anxiety. So we need to decrease the fear by discovering the causes. For example, we must learn not to over-assign a sense of harm or danger to our circumstances, and we must not over-assign the probability that this perceived danger is going to affect us. And thirdly, we must not over-assign our incompetence, that is, our inability to handle the situations. So in all of that, we try to develop our competencies by learning how to assign harm and danger more accurately, and also by developing our coping skills and using our personal support system. A lot of people work at developing those skills. A lot of people use their personal spiritual faith to help them. But all that's very important in terms of healthy thinking.
And how do you go about doing that? How do you kind of step back and assess whether or not you are assigning too much fear to something or overthinking something too much?
Well, sometimes we tend to jump to the conclusion that, and this may get back to that, you know, the negative thinking about the cup and so forth. We tend to jump to the conclusion that a certain situation is inherently very, very dangerous when it's not. Now, the other extreme is to under-assign harm and danger. So healthy thinking means that we learn through experience and through training to assign harm and danger more accurately. And that helps us then in terms of not setting up more and more fear.
How can a licensed counselor help someone out with assessing these things?
Well, that's a very good question. In professional therapy, we learn, especially cognitive behavioral therapy, we learn how to go about making those assignments or assessments more accurately. And also we learn other coping skills that will help us in dealing with whatever amount of anxiety is produced. Basically, as we learn to think in a healthier way, our lives are happier and healthier and better for all of us.
That sounds great. Thank you so much for joining us today, Dr. Baker.
I'm glad to be here. Well,